Hello, my name is Michael Morgan, and I'd like to welcome you to Cranial Sacral Therapy for Longevity, Background Research, and Resources for Prevention and Treatment. And in this brief presentation, we're going to talk a bit about what is cranial sacral therapy, some of the benefits, some of the research, the general benefits for the general population, and how it applies to the senior population specifically, and to the prevention for Alzheimer's dementia, and give you a brief outline of how to follow up for some resources for further education in your setting. So the first thing, what is cranial sacral therapy? We can describe cranial sacral therapy as a gentle hands-on light touch technique that allows the mind and body to settle down, rest, and rejuvenate. And one of the key features of cranial sacral therapy that I like to mention is that it's very gentle, very non-invasive. It can be used on infants, children, the population of all ages, and especially seniors. And because it's so gentle, it's really, I think, one of the perfect techniques to really work with a population that might be a little more at risk and a bit more fragile. Cranial sacral therapy was developed by osteopath Dr. John Upledger in the early 1970s. Dr. Upledger studied in Kirksville, Missouri, and he followed in the footsteps of pioneering researchers such as older osteopaths by the name of A.T. Still and William Sutherland, who really developed from the 1890s onward this osteopathic technique. A.T. Still founded the Kirksville College of Osteopathic Medicine in 1893, and there was really the feeling in the time that he started his pioneering work that osteopathy is a very gentle, light hands, light touch technique, could really recruit the inner resources of the body. There was a feeling at the time that the body had its own natural pharmacy, and if recruited and listened to, the body could start to realign and heal itself. So it's on that basis of the osteopathic tradition, which many say chiropractic grew out of that, and Dr. William Sutherland that developed cranial osteopathy, the Dr. Upledger developed this modern form of cranial sacral therapy. And since the formation of the Upledger Institute in 1985, we have trained over 100,000 therapists worldwide. Nowadays, when you hear cranial sacral therapy, even from the last 5 to 10 years, it's really known as a technique that's recognized and has been out there for people to look at because of its applicability to many different areas in treatment that we'll mention briefly in this presentation. Now, how does cranial sacral therapy work? It allows the core nervous system to reset itself. I kind of joke that cranial sacral therapy is like hitting that red reset button on that water heater or the furnace to get a reset. And in many ways, cranial sacral therapy, because it works at such a core level of the body, it allows that transformation and resetting to occur. Part of this is achieved by increasing fluid flow on all levels, whether it be blood or cerebrospinal fluid or water or interstitial fluid in the body and brain, which has a very positive and beneficial effect because it can result in improving vitality in the body, helps improve memory and cognition in the brain. And in this next slide, we see an overview of the cranial sacral system. On the left, we see here at the top, of course, the head, which is really ensheathed by a meningeal system, which is only a few millimeters thick. It's right underneath the bone in the head, and it encases the brain tissue itself. And it's within this very thin sheath that the cerebrospinal fluid flows. And then the head, of course, connects to the spine and comes all the way down to the sacrum. And the cranial sacral system is named for the cranium at the head, the sacrum at the sacrum, and in between this dural tube, D-U-R-A-L, dural tube that ensheathes the spinal cord. And of course that dural tube is surrounded by the bone itself to help protect it. And Dr. Upledger in his pioneering work really helped define the cranial sacral system as a fundamental system in the body, as a body system, as fundamental as the respiratory or cardiac or nervous system, and he started to look at the interplay of all these systems and how cranial sacral therapy and the cranial sacral system at the core can help underlie and influence all these other systems as well. And that image on the right, the brain and meninges in the spinal cord, gives you an idea of how that very thin covering of the meningeal system really ensheises the brain, all parts of the brain, and helps bring nurturing cerebral spinal fluid to the brain itself at the core, helps prevent the brain from injury, and helps remove waste products. And the drawing in the middle, the lateral aspect of the skull, gives you an overview of the plates of the skull itself and how craniosacral therapists are trained to very gently blend with these different aspects of the skull to get some beneficial changes as they apply their therapeutic techniques. Now, some of the benefits of craniosacral therapy across the board. Over 30 years, we've noticed the following benefits in the general population. It helps with headaches and migraines, really a crowd pleaser with many, many people. We've had some very good results with that. It helps with lower back pain. Not all the time, but in a wide variety of cases, we found some very, very beneficial effects in treating lower back pain. Immune system disorders. Dr. Upledger was a pioneer in looking at inflammation as the cause of a lot of immune system orders, or a byproduct of that, really strictly speaking. Long before the idea of inflammation became popular, Dr. Upledger was speaking about that with his mentors and speaking about the effects. So we've had some very good effects in treating people with immune system disorders of many, many types that often can be very puzzling, that craniosacral therapists with specialized training can help address. Pediatrics. With infants and children, especially children that have autism or cerebral palsy, or sensory integration disorders, any variety of issues like this, we've had some pretty good success with pediatrics. And it was in my study of pediatrics and working in infants and children that I realized that craniosacral therapy could be applicable to the senior population, because of course when you have both ends of the age spectrum, you have a bit more of a vulnerable population. And that led me to really see that craniosacral therapy could be helpful for seniors as well. Post-traumatic stress disorder. We've worked with Vietnam vets, Afghan vets, vets that have been in Iraq, and we've had some pretty good results, allowing a lot of that deep-rooted trauma that's been encased in the brain and central nervous system to be released in a very safe way. And it seems that these vets and soldiers that have worked with therapists have actually begun to be able to bond with them and feel very safe. So it's a very non-invasive way to work with some fairly challenging situations. And really, in a sense, as an aspect of post-traumatic stress, we've been working more and more with professional athletes and brain concussion. We've been doing some studies with NFL players. And the reason I got drawn into assisting in that specialized area is that I realized the brain scans of many NFL players looked a lot like the brain scans of people with Alzheimer's dementia. And I began to think, if we could demonstrate a positive change, which we're starting to see in professional athletes, perhaps then that could also be of assistance to those that did not have as much celebrity, but definitely had memory challenges, like the 5 million people plus that are diagnosed with Alzheimer's dementia in the United States today. How can craniosacral therapy also help with dementia and Alzheimer's, based on what we've just discussed? Well, there was a research study that was conducted, and the results were printed in the Journal of Gerontological Nursing in 2008. And the title of the study that I helped coordinate as a consultant was called Craniosacral Therapy Still Point Technique, Exploring Its Effects with Individuals with Dementia. Now, a summary of the research study. It was a study funded in part by the National Institute of Health, really only a few $1,000s, but that funding helped fund the therapists that applied the technique and help with the analysis of statistics and some of the structural aspects of the study. It was basically a 6-week study on folks in nursing homes that had moderate to severe Alzheimer's. And basically the design of the study was to administer a cranial sacral therapy still point for 5 to 10 minutes a day for 6 weeks at the same time every day. And part of the design of the study was to really look at behavior and agitation. Of course, as you know, in nursing homes, agitation can be a big factor in terms of taking resources of staff and administrators to deal with that. Drug treatment has, of course, been one option in the past. And we looked to see if we could actually help reduce agitation in that population. And we also looked at the baseline evaluation. We did a before, during, and after evaluation. We looked at memory, cognition, and evaluated a study to look and evaluate the effectiveness of the technique. Now, the results of the study, we saw that we achieved clinical and statistical significance. Not just by chance, we saw that there was a change from before, during, and after the intervention of the still point technique. We found a reduction of all categories, meaning neurologically, behaviorally, and otherwise, that across the board we found some changes that we could document. And these changes continued in the post-intervention stages, meaning that even after we stopped applying the still point for some weeks thereafter, those changes began to, were shown to linger. And noticed by certified nursing staff and family members, they also noticed the change. Just as one anecdotal point, clients began to recognize their caregivers and relatives. We had one 100-year-old lady in a nursing home in Minneapolis that began to be able to speak in complete sentences and feed herself. So we thought we had documented some significant changes as we went through the study. Now, we can ask what causes these changes, some of the theory which would explain some of the changes that we saw and observed. Part of the theory is that cranial sacral therapy affects the flow of cerebral spinal fluid within the body and the brain itself. Now, normal adults have a daily turnover of anywhere from 600 to 800, depending on who you read in the literature, milliliters of cerebral spinal fluid in their systems. And Dr. Upledger began to notice as we age, middle-aged adults have reduced turnover of CSF. Of course, what does it mean middle-aged? That could be 40, 50, 60 years old or more these days. But we notice that in many cases, middle-aged adults have reduced turnover of CSF, sometimes as much as half the normal amount of that 600, 800 milliliters a day. In my nursing homes, my nursing friends that helped me research this found that patients with senile dementia may have a turnover of 75% less than a normal adult, or as little as 200 milliliters a day. So it's a significant reduction from normal turnover of cerebral spinal fluid. So there's an opportunity for change here in terms of treatment, prevention, and the cranial sacral still point. The idea is that if there's an increase in the volume of cerebral spinal fluid, this will help clear toxins and accumulated restrictions in the brain, including amyloid plaque and neurofibrillary tangles, which are part of the signature symptoms, if you will, when they image the brain to say that people with Alzheimer's dementia, by the time they have accumulated amyloid plaque and neurofibrillary tangles, that's a pretty good smoking gun and an indication that Alzheimer's and dementia exist in the brain. And the idea is the still point, by increasing that flow of cerebral spinal fluid, helps prevent the formation of harmful toxins, inflammation, and amyloid plaques as we age. Now, the benefits of the still point, which is an easily learned administrated technique that's usually taught over 1 to 2 days, it helps increased blood flow to the brain. It helps increase the flow of cerebral spinal fluid, as we've discussed. It helps increase flexibility of the central nervous system. It helps in the reduction of stress, and of course we found in seniors have their own form of stress and worry, not to mention anyone in the general population. so it can help reduce stress. It can help stabilize and even lower blood pressure because you're affecting the sympathetic nervous system. If you can get a moderation downward and more of a parasympathetic tone, you're actually allowing the arteries and veins to basically relax. You get more flow of whole blood volume and flow, and hence a reduction in blood pressure. So that's another nice benefit of the still point. It helps decrease cerebral and pulmonary congestion. We find that even middle-aged people in hospitals began to develop cerebral and pulmonary congestion. Still points are a way to decrease that. It helps again remove metabolic waste because there's more increased cerebrospinal fluid flow. It helps again reduce headaches and migraines. And again, it helps remove metallic toxins across the blood-brain barrier, such as aluminum and mercury, and get them out of that blood-brain system. That can complicate cognitive function and cause problems which are not obvious. So it helps flush that out as well. So educational resources for assisted living, nursing homes, and memory care facilities. 2 classes have been developed for healthcare professionals. One is a 1-day class called An Introduction to Cranial Sacral Therapy for senior care providers. This is a 1-day class. There's also a 2-day class entitled Cranial Sacral Therapy for Longevity, Applications for Alzheimer's and Dementia. Now a little more depth in this. The 1-day class, An Introduction for Cranial Sacral Therapy for Senior Care Providers, the 1-day class, it's really been created for MDs, geriatricians, functional medicine doctors, RNs, OTs, speech therapists, PTs, CNAs, and nursing home administrators. And this class gives an overview of cranial sacral therapy. It talks about evidence-based research for CST on the general and the senior population. And there's training in a few techniques, such as the still point technique I just mentioned, that can be used for self-care or for senior care. Now the 2-day class, it's more of an in-depth training for healthcare professionals that would attend a nursing home or a senior care facility on a daily or semi-daily basis. People are actually administrating this technique. And also for lay people that can treat their loved ones at home. And it gives an overview of cranial sacral therapy. Information and approaches specific to this population are included. And again, people get trained in the cranial sacral therapy still point and other techniques with an emphasis on assisting in at-risk, early, and mid-stage dementia. So here are some further resources, books and DVD resources. There's a book entitled The Body Energy Longevity Prescription. If you have a presenter with you, they can provide you a copy. If not, we'd be happy to send one to you. And it's entitled, again, The Body Energy Longevity Prescription, How Cranial Sacral Therapy Helps Prevent Alzheimer's Dementia While Improving the Quality of Your Life. And I really wrote this book to help connect the dots, to give people a basic understanding of some of the research that's been done in the last 20 years on Alzheimer's dementia, and connect the dots between inflammation in the body, how that can overflow in the brain, and what's the connection between diet, inflammation, diabetes, trauma, and other related issues, really pointing out that often with Alzheimer's dementia, it's something that just doesn't appear overnight, but it's been an accumulation of trauma over many decades, pointing out how all those things are interconnected. So that's further depth for you if you'd like to look into that. There's also a companion DVD entitled Your Health, the Nation, and the Senior Healthcare System. This is a documentary with leading people in the senior healthcare system, including Dr. Bill Thomas, who founded Eden Alternatives, and his newest effort is called Greenhouse Homes, really speaking about how the senior healthcare system can be transformed, how we can emphasize and improve quality of life for all our clients, patients, and residents. Finally, your local therapist you can use as a contact or a resource. Your local therapist can provide you with copies of research and other background information. They can arrange an in-house presentation that I can come to, or they can present to your staff and residents who may be interested, and help coordinate that 1 or 2 day class that I mentioned. And they are able to also provide individual treatment for staff and residents, and they're part of our national referral network of trained senior therapists that are specifically trained to work in the senior healthcare industry. For more information, you can contact your local resource, and feel free to visit my website at www.bodyenergy.net or contact me directly at michaelm@bodyenergy.net. I'd be happy to correspond with you, answer any of your questions. And really, our whole focus here is to be of service to you in helping to support our seniors and really improve the quality of their life and their longevity. So thank you very much for listening, and we look forward to speaking with you soon.